I am joined today by CBN News medical reporter Lori Johnson. How are you?
Fine, thanks. And you?
I am doing well, and we are here today to talk about this CDC story. It's a very interesting story, and we want to break it down for people to help them understand. But basically, the Centers for Disease Control is being criticized right now for withholding key pandemic-related data. Now, that's the 30,000-foot view on it. Can you take us through this story? Help us understand what that accusation is.
Well, absolutely. And you know what? It's actually more than an accusation, it's fact. So these aren't just criticisms or accusations, these are actual facts that the CDC actually admits to. So the question is, what did they do? And how serious is that? And most importantly, moving forward, how can we make sure that this doesn't happen again? So the good news is the CDC admits to this, and it's kind of hard not to because the evidence is clear, and they admit to withholding information, and they say the reason that they did it was twofold. And the first reason is kind of, you can sort of see that, and the second one, a little bit, but maybe not so much. So they say the reason they held this information, and I'll get into the specifics in just a second, is because they didn't have all the facts. It wasn't ready to be released to the general public yet. The CDC is this monstrous bureaucratic agency. It takes them a long time to compile data and get it just right and check and double check and then run it past all their superiors, then run it back past the Health and Human Services Department. The CD is under the HHS, and also run it past the White House. Let's not forget that the CDC is a political arm of the government. And so there are all these different nets that the vetting process that it has to go through. And they said that's part of the reason why it took them so long to publish certain information that they've had since the very beginning of the pandemic. The other reason they said they sort of withheld certain information is they didn't want the general public to misinterpret it.
Hmm.
Specifically, they didn't want the public to get this information and wrongly conclude that vaccines were not effective. That's a problem. That's a big problem. So those two reasons, they both need to be cleared up. So what did they withhold? So it's important to remember that the CDC did not give us information that was wrong. They didn't lie to us. They withheld information. And that's problematic because any of us, we've all done it, right? We've all done it with our children, told them certain things, but not told them other because we wanted to manipulate their behavior.
It's the sin of omission. It's the sin of omission. You
Yeah.
admit
And,
exactly.
we all do it to some extent. The end justifies the means. I didn't want to tell my teenager that sometimes people do win the lottery because I don't want them to start gambling, things like that. So the CDC didn't want to give information to the general public because they were afraid that the public would say, oh, well, vaccines don't work. And that's problematic. So they withheld information. Probably the worst thing is they had information about the effectiveness of booster shots. Between different age groups, and they really only reported the effectiveness of the boosters of people age 50 and over. So that 18 to 48 age group, they had that information, but they didn't present it to the public. And that age group showed that they were least likely to benefit from boosters.
Now, they have not released that still, correct? I mean, so
No,
that
no, they
data
have
is
released
still
it. No, they
okay.
have released it. They did
Okay.
release it last week after this article came out. And so, yay media. That's the power of the media. They expose things and get people to act. So they have now published this. So that's problematic. Also, we know earlier there was a large outbreak of what they call breakthrough infections. So these are people who were vaccinated, but who got COVID. And the CDC stopped, publishing that information because a lot of vaccinated people were getting COVID. And so the theory is, if we tell people that vaccinated people are getting COVID, they're not going to want to get vaccinated. They're going to say, well, vaccines don't work. But that's not true. The more people who get vaccinated, the more people who are vaccinated are going to get COVID. It's a little complicated. And so their reasoning is, hey, it's really kind of complicated. It's nuanced. It might be too complicated for the general public to understand. And just let's not tell them.
Can I ask you a question about this though? Because it's so interesting. You're a journalist. I'm a trained journalist. When you look at this and there are all of these omissions, even with a good, look, they're doing it in their minds for the right reasons, perhaps. But it seems to breed more distrust by saying, oh, let's hold it back so we don't have these problems. You sort of seem to end up with them anyway. And by them, I mean the issue of people saying, well, why are they holding it back? What are they hiding? It seems to sort of breed more of that. And it just creates a little more confusion. And you would think, I mean, it seems like this has happened sort of throughout this process from the masking at the beginning down the line.
Oh,
Again, good
yeah.
intentions. But what do you make of that?
Well, clearly you're 100% right, not just in this case, but in all cases. It's human nature that if somebody doesn't tell you the whole truth, that just deepens your mistrust of them. So it's a terrible strategy. Any public relations person would tell you that's the absolute worst thing to do. It always backfires in interpersonal relationships. And if you're married, tell your spouse that you're not just working late, but you're working late alone with somebody of the opposite sex who's really attractive. If you leave that last part out, your spouse is going to be really mad and not trust you in the future. Same thing with the CDC. I mean, if you leave important information out, they're not going to trust you in the future. So moving forward, the CDC needs to get its messaging on track. They really need to hire public relations people. They really need to present all of the information to the American people and double down on that and explain it in detail. So if you're worried that people are going to get the wrong idea about vaccines, explain it even more rather than withhold information. So moving forward, they absolutely need to give all of the information and explain it very thoroughly. You brought up the mask situation. This was a huge gap at the very beginning of the pandemic, which sort of started people distrusting the CDC and other major public health organizations. At the very beginning of the pandemic, a lot of people might not really remember, we were initially told not to wear masks. Remember that?
Yep.
And they said it's because masks don't work. So everybody was like, okay, masks do. And then they later came out and said, actually, we knew all along that masks did work, but we didn't want the public to know that because we needed to save all of the masks for our frontline healthcare workers. And if we told the American people that masks helped prevent this deadly virus, then the American people would buy up all the masks and there wouldn't be enough for the healthcare workers. So you can
See,
kind of see
that's
what they're saying, but people are
right.
like, no, no, no. You should have just told the American people from the beginning exactly that, the truth, which is yes, masks work, but please don't buy them because the healthcare workers need them more than you. They were
Right.
like, no, the American people cannot handle that information. They'll scoop up all the masks and wear them, and then the healthcare workers will all die.
Well, and
So,
then when you really needed them, right, when they were saying during the point where it was at its worst,
yeah,
they're sort of they have people who no longer trust them because
right.
of that, right? So
Yeah, yeah,
that's sort of the problem with this. Now you've seen obviously the data, you've looked at the story. There are going to be a lot of people now who are still hesitant and they're wondering what was in this data. Do we have anything to worry about?
mhm,
What would you say to those people who, they've read the story and they're still sort of curious
yeah.
about that data?
Well, the good news is it's all out now. So what it's out, and the data is like, for example, one of the things that I'm most interested in is they withheld data on wastewater. That is, this is a little gross, although some of us think it's kind of cool. When you have COVID, you shed the virus, and you shed it to other people. That's how you infect other people, but also it's in your feces. So it goes into the wastewater system, and they can look at your wastewater system and see how much coronavirus is in that area. That is the most accurate way to monitor how much COVID is in a certain community. And it's also the earliest warning. So, what do I mean by that? Well, we noticed, especially with Omicron, a lot of people who had COVID, they didn't report it. They maybe got a home test and they didn't tell anybody. So, when we talked about the numbers of people who had COVID, that was probably way off because a lot of people didn't report. A lot of people also
Yes.
are asymptomatic, but guess what? It's in their feces. So it's in the wastewater. And another thing is before all of these numbers are tabulated and sent to the CDC, I mean, you get them right away with wastewater, and they post that every week. So some places across the country had that wastewater data since the very beginning and were giving it to the CDC, but the CDC didn't post it because they didn't have it from everywhere. Still, only 31 states are giving that wastewater data. That's something that, individual communities have to give to the CDC. So, they were like, well, we didn't have all the information, and so we didn't really want to post it. But that is extremely valuable information for me personally. I want to know what's going on with our wastewater where I live, because when that number starts going up, I know that that a wave is coming, and I'm going to start taking more precautions.
Yeah, well, and
So,
it seems to be among the most accurate data, as you were
yeah.
saying, when you have before we didn't have tests, then they were really hard to get. Now you have them, but there's so many at
Mhm.
home tests, and we could have the whole discussion about how accurate those are. But that aside, if you're not reporting most of these cases, and we're out there saying, oh, it's gone down by 50%, and
Right.
very few people have it. Well, the
Right.
most accurate measure would be the wastewater, it would seem
Yeah.
then.
Yeah, absolutely. And so I love that. And I'm really glad they're reporting it. But again, it's not all the CDC's fault. A lot of communities aren't doing it. And it's not because these places are bad or they don't want to participate. It's often they just don't have the personnel. I mean, it's just extra, it's a lot of extra work. And a lot of these communities just don't have the manpower. So that needs to improve. So all of this information being withheld, the CDC readily admits we're slow. It takes us a long time to compile data and to give it to the public. And up until this pandemic, we haven't needed to know tons of information immediately. But with this pandemic, we have, and the CDC was not equipped to do that. So moving forward, they have been given $1 billion, billion with a B, to improve its data collection and dissemination, which is important because, hate to bring this up, but we have to think about the future
Absolutely.
pandemics. I mean, right now we're like, don't talk to me about any future pandemics. I can't handle the thought of it, but we need to think about it. And if not a pandemic, then another health emergency. And I really feel personally like maybe God has been gracious to us in this pandemic, in that we learned a lot of valuable lessons about what we did wrong. And the death rate in this pandemic was about 1%, which is very, very high, 1% out of 100. But when you think about it, it could have been a lot worse. We've had other epidemics like AIDS, where the death rate was like, 100% before there was any treatment, or Ebola, where the death rate is like 80%, and other forms of coronaviruses like SARS and MERS, where the death rate is 10 and 20%. Luckily, those weren't as widespread. So, God forbid, we might get another pandemic that has a much higher death rate. We need to get all these kinks worked out in the system, especially
Yeah.
with the CDC.
Well, and this is hopefully it's a lesson learned for everybody, right? It's easy to go after the CDC, and the CDC definitely needs to do better, but this is a lesson learned, right? This is the first time we've had the resources to pool together to get this information out there. And the hope is that we've learned some lessons here, that the CDC has learned some lessons, and that God forbid this happens again in the future, we are able to weather it in a much more cohesive way, especially when it comes to the data. Lori, thank you so much for joining us today. Everyone else tuning in, make sure you head over to CBN News and download the CBN News app today. We'll see you again very soon.
Thanks for having me. Take care. God bless.